Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this video, we're going to look at hip abduction exercises and how to progress your hip abduction exercises with different positioning. Hi everyone, so today we're looking at hip abduction. So hip abduction, abduction, is moving the hip out away from the center of your body sideways. So this is a movement that is incorporated with activities. It's also something where the muscles that perform hip abduction are actually very active in an isometric way. So in a way where they're not actually moving, but they're contracting to provide stability for your hip and your pelvis when you're doing different activities, such as standing on one leg, having the other leg in the air, moving, walking, going up and down stairs, and all sorts of different things. So it's important to have good strength in your hip abductors, your gluteus medius, your gluteus minimus muscles for functional activities and being able to do different activities throughout your day-to-day life. So the easiest hip abduction exercise is going to be laying on your back. And this is going to be in a position where gravity is eliminated, so you're not having to lift the leg against the force of gravity. So typically a good way to do this is make sure you're on a surface that slides well. Sometimes like on your bed, typically will slide all right, on a carpet, wherever you can get where you can slide that leg back and forth. So again, you're either laying completely flat on your back and going in and out with the leg. You can also do it in this kind of long sitting position as well. It's going to be the same dynamics, same amount of difficulty. With all of these, you want to shoot for maybe 3 sets, maybe 8 to 12 reps, working on strengthening these muscles. This exercise hopefully will be pretty easy to do, and then so you're going to want to progress to either laying side lying or in standing. Side lying is actually going to be the most challenging in terms of overcoming the forces of gravity. So you're going to have to go straight up against gravity to perform this exercise. A couple things with side lying is I like to bend the knee underneath to provide a little stability. And then you're keeping this leg nice and straight. You don't want to rotate your hips forward. You don't want to rotate back too much. You should have good aligned torso and hips aligned with the surface. And you're just coming up and down. Don't have to crank it to do super high, then you're going to start to lose good technique. You just want to go within a comfortable normal range. Again, trying 8 to 12 repetitions for a couple of sets. So this one, obviously, you're going against gravity. It's going to be the most difficult. And then, of course, you can then go to standing. So with standing, you are still going against gravity a little bit, but as you can see, it's not that straight plane straight against gravity. Only a part of the motion is actually against gravity. The challenge with standing, of course, is you incorporate the need to have good balance, good stability in a standing position. So sometimes initially you might want to have that countertop, that chair, something to hold on to provide stability when you're doing the exercise. And it's the same exact motion, not trying to go too forward. That's a compensation of bringing in these hip flexor muscles. You want to go straight out to the side within a comfortable range. Don't try to go where you're moving your trunk or your back too much. You shouldn't be bending side to side. It should be all coming from your hip, and the back and everything should just stay in this good upright position. So really, the best progression in terms of purely looking at strengthening your hip abductors is going to be supine. Laying on your back is the easiest. Then the next hardest is going to be standing with some type of upper body support. And then the most difficult is going to be the sideline position where you're going straight up against gravity. With all of these, you can of course then progress the intensity by adding resistance. Probably the easiest way is a TheraBand. So wrapping that TheraBand loop around your legs, You can do that in any of the positions, or you can also put some ankle weights, work well with the sideline position and in standing. If you're adding resistance, you really are probably progressing past the laying down position at this point. So I wouldn't add resistance to this position. I would instead transition to either the sideline or the standing position if this one has become easy to do. So that's your hip abduction exercise and some ways to progress it by changing your position. Thank you very much for watching, everyone. As always, please subscribe if you like our videos. We post every day. And check us out online at kneereplacementtherapist.com.